Viz has a very important role in COVID. There's really 4 challenges that we face in the COVID area. Number one, the quality of our ability to take care of stroke patients, particularly LVO patients, has dramatically dropped in the era of COVID. Originally, Shanghai reported a 50% drop in the thrombectomy numbers. It turned out across China, the studies recently have suggested it's more like 25%. Patients are presenting with atypical strokes. There are strokes in younger patients, which are LVOs. You have fewer neurologists in the emergency room in many cases because the neurologists are getting pulled to do other things in these very busy COVID centers. Mark Fisher was an author on a very important paper in stroke, which in the discussion section suggested that we should think about doing CTAs on all patients that come in with strokes that have real bona fide stroke symptoms in order that we bolster the quality of stroke care. I think, and not miss these LVO patients. I think there's a tremendous amount of wisdom in that. And partnering that with LVO detection in the software is exactly what we need to do to keep our patients safe. So safety is number one. Second is, the safety of the care of the stroke patient and maintaining quality stroke care. Number two, safety of patients. Viz is very important in terms of safety of the patients. You protect the patients by minimizing futile transfer. We've already talked about how that protects the patients by keeping them at centers that may have much lower COVID numbers. Thirdly, protecting the resources of the hospitals. Hospitals are now very, very taxed in terms of limited PPE, in terms of limited staff. And by minimizing bringing all of those extra patients to the hub hospital, you are going to protect their resources in a very important way. So I think Viz can have a significant impact there. And then lastly, on the financial front, bolstering the hospitals financially. And Viz does that in 4 separate ways. It does it 2 ways for the spokes and 2 ways for the hubs. It protects the spokes by, number one, allowing more patients to stay. It increases their volume. They make more revenue. Number two, if there's an LVO patient, you don't want an LVO patient staying in a spoke hospital because they're going to be very severely injured patients and they're going to have high direct expenses. And those patients will cost the spoke hospital a lot of money. So LVO detection gets the patients out of the hospital. And it helps finances for the hub hospital, as I mentioned before, by increasing their number of thrombectomies and decreasing and by speeding the patients to the table, which decreases direct expenses, decreases length of stay, allows them to capture more money. So very, very impactful during this era of COVID-19.